I'm Jason Hutchison. I am a physical therapist with Franciscan Health. My specialties include manual therapy, orthopedics, sports medicine, and dry needling. Dry needling consists of the utilization of filament-type needles, very thin needles, and they are inserted into the body, into certain muscle groups to try to release pain, tension, discomfort. It helps with flexibility. It helps with neurologic symptoms and things like that are associated with chronic long-term type pains. All of our treatments, except for dry needling, are done on the surface. So that's where we have ultrasound, heat, ice, massage, TENS units, things like that. When I can get 1 inch to 3 inches deep into the muscle, I'm getting to structures and these trigger points that we can't touch. That's the biggest benefit of this treatment. For dry needling, the most common areas that are treated tend to be low back and neck and shoulders, mainly because the highest percentage of patients that we see are being treated for that. It can be done for any body part. It can be done as long as it's in the muscle. We don't do it in a tendon, we don't do it in a joint, but it's in that muscle belly, and that's where we have the best effect. I would like to stress with dry needling, I get this a lot, that I get patients that tell me they're coming for acupuncture and things like that. I want to state, well, first and foremost, it is not acupuncture. Very similar. The thin needles are put into the skin. Acupuncture is based on Eastern Chinese medicine from several hundred years ago. Dry needling is very simple. I'm going to palpate. I'm going to poke around with my fingers and find where you have those tender spots. I'm looking for two very specific responses. It's that ache or that twitch, and it is a very quick treatment. A lot of setup, a lot of evaluation with hands-on and stuff, but the actual needle in the skin time is very short. Dry needling can be used for just about anyone that comes in the door. There's very few people that we don't do it to. The immediate response from the treatment is you will feel increased range of motion. You will easier movement, things like that. The side effect is the biggest relief is only about 24 to 36 hours after the treatment. So you will feel some soreness. The vast majority of the time, it just feels like you had a major workout. You just have a little bit of muscle fatigue, a little bit of soreness, and then the next day we're good to go. But from a risk standpoint, very low risk with a potential for very high reward. This can be for people that have had chronic pain for years, 10 years, 15 years. I've had good results with it. It could be somebody that had surgery three weeks ago. I've had good results with that. We go to this route and we're able to get some results that you couldn't get previously. And it really does open some avenues for some relief that the patient hasn't had in the past. At Franciscan Health, we have several therapists that are certified in dry needling. You are able to refer yourself to physical therapy. We call that direct access. We recommend that everybody call our front office and ask the front office if you can refer yourself to PT. They will tell you if that is possible, and then dry needling is not specific. It can be done as long as the therapist deems that it is an appropriate treatment. We can do it as part of your ongoing care. If you feel that dry needling is a treatment that you would like to pursue for your chronic pain or acute pain, please visit franciscanhealth.org/rehab.